Hello, I'm Dr. Mark Kohout. I'm a board certified plastic surgeon, and today I'd like to talk to you about liposuction. Liposuction is one of the commonest, most popular operations that any plastic surgeon will undertake, but there is a bit of subtlety and a bit of shading to it. You might have heard a whole bunch of terms around liposuction like laser lipo, VASA, SAFE, micro air. There's a whole bunch of technologies that we can use to give you a result. And I just want to talk to you about some of the techniques that are on the market and some of the techniques that I use. And let's kind of have a look at, what's good at doing what sort of liposuction. All right, so let's start. So the traditional liposuction has been around for a number of decades now, and it's still effective provided it's used judiciously and carefully. However, some of the newer techniques, provide a whole bunch of perks on top of just reducing your lumps and bumps, basically. Some of the perks with the newer technologies include like smoother contouring, lesser risk of skin looseness, so we can actually now deliver skin tightening as well as just reduction of the fat pockets. And some of these techniques are better than others. All right, so let's say one of the most popular techniques on the market is VASA, which uses ultrasound energy to break down the fat pockets, but it doesn't actually remove the fat. So we have to then follow up the breakdown of the fat cells with liposuction so that the broken down fat is physically removed from your body, from your tissues. So it's kind of a two-step procedure. It's obviously done in the same procedure, but it's a two-step process. And so it takes a little bit longer than just straightforward liposuction. There is laser liposuction, which kind of does similar thing by breaking down the fat cells in the affected area by heating them up with laser light. Again, laser lipo just breaks the fat cells down. It doesn't physically remove the fat. So again, two-step process in this. But the laser does have the additional advantage of tightening the skin. Laser lipo is a fairly, I suppose, tedious, time-consuming procedure because the laser's fairly slow to work. So generally, laser lipo is good for small areas or limited areas or limited volume liposuction. My preferred method is to combine micro air. So micro air is the hardware, it's the machine that's used to break down the fat and actually suction out the broken down fat. It uses a rapidly vibrating probe to break the fat cells down. And again, it's the suction is done actually at the same time. Whenever it's required, or if the situation calls for it, I do the skin tightening or tissue tightening at the same time with technology called Body Tight or Ignite RF, which uses radio frequency currents to heat up the tissue, heat up the skin, which then causes it to contract. So with this combined technology, we can now do liposuction on patients which probably wouldn't have been good candidates in the past due to risk of having skin looseness after the procedure, and we can tighten the skin. And sometimes you can even avoid doing a bigger procedure like a tummy tuck, for example. If we can tighten the abdominal skin or the arm skin or thigh skin even, it's quite good in the thighs, then we might be able to avoid big excisional operations like a thigh lift or an arm lift. So we've now got kind of a expanded range for what liposuction can do and can do successfully. So that's my preferred method. The micro air with SAFE technique is very good. It has been shown to deliver smoother, more even sort of results, and the RF skin tightening reduces or minimises the risk of any burns or adverse effects like that. So that's my preferred method. Every surgeon does something slightly different, but that's kind of what I do, and I've been very happy with the results that I've got with these. So ultimately, if you're interested in liposuction, come and see me. I'm more than happy to give you the lowdown and do the assessment, and I'll see you soon.